In India, I've seen one research is going on. Why there is a less number of infections and death in India in comparison to other world. And I have seen that they are just examining whether there is a existence of any microbes in the skin and oral cavity, which is just unique in this region. So the people are protected.
Okay.
Yeah, they have started it. I've seen they have started it.
So guys, we'll start officially.
Okay.
We'll start 0 officially. We see Dr. Chong is here after a very good vacation. I was just being told by Mr. Ravi that you were making jealous everyone on the Facebook's posting up pictures. So welcome everyone. This is 84th CMAAO session, international weekly meeting. We are achieving towards 100. Very important topics. COVID is almost very on a downscale on a lot of countries. Yet this is still a session where we are understanding what's going on. A lot of countries are in a phase of applying booster shots. A lot of countries are in a phase of giving vaccination to children. I know US, Philippines, they all have started. So again, this is an international weekly meeting in association with CMAAO, with a lot of medical conferences, medical associations. So we have today where we are getting an update from all the medical associations. I would like Dr. Chong to chair this meeting with me and take this discussion forward. And we are on 13th of November. Over to you, Dr. Chong, with me. Can we start? Still the time, a lot of people, otherwise they will join.
Hi, everyone. Good to see you all.
Hello, Dr. Chong.
Are you in Singapore?
We
or
were
are
on
you still
vacation
in
for
France?
last two weeks.
Dr. Chong, are you in Singapore or in France now?
I'm back home. I'm back home.
Okay, with all the wine and all consumed already.
It was easily a bottle a day.
Okay.
That's not bad, actually.
Just to start, I tell you what, thanks everyone for attending the meeting as usual, and it's good to see everybody back here again. Maybe I'll just start and show you what's happening in Singapore, because it's been 2 weeks since I showed you what's happening in Singapore. Can I share screen, Shara?
Yeah, we'll start with Singapore. And
okay. So I'll just show you, can you see my slides? Can you see the pictures?
Yes.
Okay. So just show you what's happening in Singapore. We have 1,616 cases in hospital, 280 need oxygen, 31 are unstable. They are not intubated, but they are unstable in ICU. 75 are intubated. So our overall utilization rate of our ICU is 67%. So we're quite worried, of course, because the 1,600 who are in hospital can anytime tip over into the ICU. Over the last 1 month, about 90,000 patients have been infected. Even though our vaccination rate is very high at 86% of the population, but we still have a lot of elderly who are not vaccinated. So they are causing a big problem. So let's look at the first chart. This shows you the ICU capacity of 400, and 132 are empty, 75 are intubated from COVID, 31 are sick but not intubated, and 162 are all the other cases, all the other typical ICU cases. So these are the figures we are publishing now every day. You can see on a daily basis. And this is the pie chart of the 90,000 cases in the last 1 month. 98.7% are asymptomatic. So they're quite well, actually. They are all mainly looked after at home, or they're staying at home. And you can see for yourself, 0.8% need oxygen, 0.2% unstable in ICU, but not intubated. And these are all the intubated patients in the last 1 month. All right. And 0.2% have perished. All right. So these are the figures. that we are seeing in Singapore. So this is a nice pie chart representation. All right. Sorry, 0.1% are intubated in ICU and 0.2% are unstable. And this is the percentage that have deceased. All right. So that's where we are at the moment. If you look at these other charts, you can see that hospitalization, oxygen, unstable, not intubated, intubated, and deceased. The gray bars indicate age. So those who are in gray are 70 years and above. And you can see overwhelmingly, it's basically the elderly, all right, who have a lot of comorbidities. So right now in Singapore, honestly, I've been talking to my colleagues in the public sector hospitals, and they are given a lot of patients with comorbidities, a lot of underlying disease. They are given remdesivir, IV steroids, and of course, high flow oxygen, 60 liters per minute, super high flow oxygen. If they swim, they make it. If they sink, they may not be intubated, if you get what I mean, because we can't intubate everyone. If we intubated everyone, our ICU resources will be overwhelmed. We only have 132 beds left to go. We can theoretically extend this ICU capacity to another 600, but the 600 will not be pure ICU. There will be like converted spaces. For example, in every operating theater, there are recovery spaces, recovery bays. So recovery beds can be converted into ICU, but they'll be makeshift ICU beds. So that's our capacity right now. And we're keeping a close eye on this because we have 1,600 of them who are in hospital. So any of these 1,006 can actually end up here. So that's where we are at this point in time. So thanks very much. Any questions from anyone?
Just a thing, you were mentioning the number of ICU beds is 400. Is COVID dedicated or as a whole?
Actually, these are total ICU capacity right now in all our public sector hospitals. Private sector has not been included in this figure yet. All right, these are basically public sector hospitals. So there's still capacity. We can still convert another. We have private sector capacity. We also have convertible beds. That means, for example, operating theater, recovery bays, etc., etc. So we can muster up another 600 beds if we need to. But anyway,
the other question, actually, you have opened the USky. I know you have opened the USky, and you're maintaining the quarantine for 10 days, I heard. So whoever entry will get entry there. So actually, what is the variant now prevailing there? Predominant variant?
Still Delta. Still Delta.
Genomic? No, it is Delta only. So what is the reason behind this? You are taking so much protective measures and others are so strict, But why the cases are increasing? Can you just explain that?
So I think it's basically the waning immunity. All right. So waning immunity and for example, myself, when I did my CPAS in August, I did my vaccine, my Pfizer in January. Remember, we were one of the earliest people to do it in this part of the world. And by August, my CPAS, my neutralizing antibody had dropped to 48%. So generally, that's why we need boosters. And our booster rate now is 19% of the population. So 86% have been vaccinated, but 19% have received boosters. So we hope with the boosting, we will cut down the figures. And right now, look at this last curve here. This is interesting. This one here, the last picture. So this is our daily infection. So this figure means that is compared to the previous week. So you see it's gone up slightly, but the last 1 week it's gone down below 1. So the number of cases are coming down. So I think the boosting is helping. Of course, we have a blip today, 1.04, but previously it was 2 times to 3 times of the previous week. So you see the number of cases are coming down. All right. So we're now averaging about 3,000 cases a day, but previously it was as high as 5,000. So it's coming down. The figures are coming down. We think the boosting is working. We have very good public health measures, but the Delta is so good. 6 billion people have been vaccinated in 10 months. And we built a wall against the virus, but the virus somehow, the Delta found its way through. So there is waning immunity. And that's the explanation.
Dr. Chong, I heard last week or probably early this week that in Singapore, they have announced that anybody who is unvaccinated with choice, they will not get any treatment, or people who are poor or cannot afford. That's a very good policy, I believe.
Okay, what's happened is that because, we have vaccinated 86% of the population, and 92 is our target because 8% are children. So we're left with another 6% of the population that are not vaccinated. Okay, so 6%, we are giving them a lot of major disincentives. Up to now, for the last, since the outbreak started, since the pandemic started in Singapore in March last year, we have paid for every single patient. The government has paid for the treatment of every single patient with COVID. So from henceforth, they have just announced that if you are unvaccinated of your own choice and you do get COVID, we will not pay for your treatment. We have a lot of safety nets here in Singapore. We have a 3M system where we try to actually use personal pension accounts, insurance, etc., to pay for your own bills. But right up to now, the government has picked up the tab for every COVID patient, right? And they did not have to use their pension accounts or their insurance. But henceforth, going ahead, the government says if you're not vaccinated by choice, we will not pick up the tab for COVID. And you have to use your insurance, etc., your pension accounts and so on. That's what it really means.
Dr. Chong, whether Singapore government is recognizing all the vaccines that is enlisted by the WHO?
Yes, it does. We recognize vaccination status, but the only change we've made is, okay, so it's very interesting. Our recognition in Singapore is by law under our public health infectious disease laws is 1 year. So from the day you're vaccinated, we recognize you as vaccinated for 1 year, the period 1 year. So for example, January, I was vaccinated. In February, I was vaccinated. So my recognition is for 1 year, regardless of booster. All right, regardless of booster. That's by law. So going forward, they have not mentioned anything about booster yet, but they've said that for Sinopharm and Sinovac, the two Chinese vaccines in Singapore, we don't have AZ, we don't have J&J. We only have the Moderna and Pfizer and the two Chinese vaccines. For the Chinese vaccines to be fully vaccinated, it has to be 3 doses instead of 2. So that's the only difference. The vaccination status does not include boosters at the moment. But for the Chinese vaccines, it must be 3 doses.
But you're compelling the people to go for 10 days quarantine, even they're fully vaccinated.
Okay. So what we're telling patients is that if you're sick,
can we close the screen? Can we close the screen?
Yes, please. Yes. If you're sick, for example, we tell you home recovery. Remember, 90,000 are at home. So most of them are at home, and we advise them to stay at home for 10 days. And at the 10th day, I mean, we assume they are well, because if you're not well, they go to hospital, right? So at the 10th day, they'll be automatically removed as being a COVID patient, as being infectious. So we are using a 10-day system here in Singapore. We advise them to stay at home, right, basically, and, stay in their room and so on. So far, nobody has really broken the rules, if you know what I mean. Everybody has been quietly staying at home if they are sick.
But the USA has eased actually that one, no? That quarantine,
Yeah, I suppose if you're a COVID positive patient, and so far we're still using 10 days, not 7 days. So if interestingly, there's a variant, let me explain, not Delta, meaning there's a variation. So if you are vaccinated and you're COVID positive, we tell you to do the ART because we distributed ART kits to every household in Singapore. So you do the ART, if it's positive, what we tell you to do is to stay at home for 3 days. On the third day, repeat the ART. If the ART is negative, you are considered normal. So 3 days of vaccinated people. If the 2 ARTs on day 1 and day 3 are normal, are negative on day 3, you're considered to be normal and you can go back to work. So that's the difference between, that's the variation. If you're
also, if everyone, if I can request, when they are talking about their country, they can talk about the children vaccination and the boosters combinations.
Okay. So, the booster combinations that we're using in Singapore is we're allowing people to use Pfizer, Moderna, or Pfizer, or Moderna. Moderna, we just ask you to do all 3 Moderna, for the boosters. All right. Some of us like myself, I've chosen Pfizer, Sinopharm, because I want to introduce my immune system to the other, I believe it's 27 proteins of the COVID virus. I want my T cells to recognize the 27, and my CPAS has done very well. It's gone up from 48 to 86% to 94% just before I left for my holiday. So Sinopharm, so Pfizer followed by Sinopharm. But in Singapore, all patients who are vaccinated with Sinopharm or Sinovac, we've asked for 3 doses to be certified as fully vaccinated. Children, no word yet. We haven't got any approval from US, so we haven't rolled out vaccination for children yet. So for the Chinese vaccines, we are not using them under 18. So for Pfizer, Moderna, of course, 12 years old is the lower limit, or rather 11. But we have not rolled out vaccinations for 5 to 11 yet. So I think that's pending. So that's the situation in Singapore. Thank you.
Thank you. This was just Dr. Chong. It was a well updated and a long due updation from Singapore. Can I invite Dr. Deborah from Brazil? I think we have been missing her also for a while.
Good day for you. Here is 1:30 a.m.
Wow.
But today I'm awake. Here in Brazil, we completed the vaccination in the 58% of the population are totally vaccinated with the 2 doses, and more, a big number of the population had the 3rd doses yet. Here, the deaths are decreasing, and new cases too. In the last 24 hours, we had 15,000 new cases, about 15 new cases, and about 600,000 of deaths. It's decreasing here. And we used the 3rd doses, Pfizer vaccine.
Deborah, are you vaccinating children?
Yes, we started to vaccinate with 15 years. 15 years. There is a license to vaccinate from 5 years, but it didn't start yet. But they are thinking in vaccinated after 5 years until 12 years. Some states are vaccinating under 15 because we don't have enough doses for. So we have to do in priority groups yet.
Thank you.
Thank you.
Sarab, you want to invite somebody else to?
Yeah, can we have Dr. Pillai from India?
Very good morning. India, of course, the infection definitely is under control. Day by day, the number of infected patients number is coming down. Now is around 10,000, 11,000 range. And as for vaccination, 1.1 crore population has been vaccinated. Double dose, about 60% of the population. And no, sorry, double dose of 40% of the population and single dose 60% of the population. And there is some reluctance on the part of the people to get the second dose, but government is trying hard to encourage them to have the second dose also. Since even the double dose regime is not completed, including the children under the vaccination scheme or thinking of a booster dose definitely is kept in abeyance until and unless the population is 85% of the population becomes antibody positive. The vaccinating children and the booster dose definitely as a public health initiative, we are keeping it under abeyance. One good news is that Covaxin has been, Indian-made vaccine has been recognized by WHO, and by now almost 103 countries have accepted our vaccine, and reciprocally, we are also accepting the vaccine taken by those countries. And economy is opening up. Rail travel definitely slowly becoming to the normal schedule. Flight, of course, domestic as well as international has been opened up. But then the double dose vaccine is compulsory, and RT-PCR has to be negative for air travel for anybody. And the quarantine time definitely has been brought down, even for those who are coming from foreign countries. 1 week of self-quarantine, that is what is recommended. And schools are opening up, and of course the teachers and all staff are to be vaccinated. And definitely when all these facilities are, including tourism, are opening up, the incidence definitely has not gone up. And here, of course, definitely is the Delta variant, which is a predominant. And the new variant, AY42, which is very much there in England and America and even other countries. Here we have taken 80,000 or more samples, and hardly few number of this variant has been identified. So as of now, the AY42 variant threat does not exist, more or less we can say. And the best part is not only in India, all over the world, no major threatening variant has been identified. And to that extent, the chances of another wave definitely is much less. But a lot of information is coming in. Europe, definitely the number is increasing. And maybe the Delta variant, even the new AY42, the number definitely is much less. But that phenomenon definitely is not there in the Asian countries, where number definitely are coming down. And studies show that even if you have an infection, don't feel that the chance of reinfection in you is not there. Studies show that unless you take the vaccine, both doses, you are prone to another reinfection. So that awareness we are increasing among our population. And antibody positivity definitely is very high now, almost 80%. Partly because of the immunization and partly because of infection. But even those who are infected, vaccination definitely is mandatory. So situation is definitely improving. More than that, even the treatment protocol has changed. I'm sure it must have changed in even other countries. The dependence on steroid is coming down much, and monoclonal antibody, single dose cocktail therapy, even as an outpatient, those who are positive and high risk category, they are given one shot of monoclonal antibody and they are allowed to be at home. And in majority of the cases, the infection gets controlled. So the hospital occupancy definitely has come down. ICU occupancy definitely is less, but India is definitely prepared for a third wave. And we are making facility even up to handle up to 4 lakhs of patients per day in our facility. So the threat of COVID definitely is coming down, but the precautions are to be continued. COVID appropriate behavior, wearing masks, and hygiene, sanitation, and social distancing has to continue if it is to be completely controlled, and probably it will settle down as a epidemic in certain pockets in our country, and we are more or less reaching that stage. And wherever there is the number of infections are more, local confinement or local micro lockdowns are still practiced. Thank you.
Thank you,
Dr. Pillai, just please let me know whether the trial for molnupiravir, which is being in Rajasthan, I came to know. Is it going on, and also the government has allowed to prescribe the doctors this molnupiravir?
You mean monoclonal antibody, eh?
No, molnupiravir, tablet molnupiravir.
Yeah. Okay. That definitely we are giving it. But then in most of the cases, as an outpatient treatment, the monoclonal antibody cocktail seems
No,
to
I'm
be
not talking
effective.
of monoclonal antibody. I'm talking of molnupiravir, tablet molnupiravir, which is Mark production actually. The company Mark has put it, and it has gone for the actually emergency authorization from FDA, but still they didn't get it. But in India, I came to know that trial is going on, clinical trial.
Yeah, trial definitely is going on. The drug controller has not approved its use. A trial definitely is going on. Of course, first it was introduced in the UK, and even in India, the trial definitely is going on. Very there.
Okay.
I think India has not yet started for the vaccination for the children and the booster shots. So that policy will come very soon.
Yeah.
Can I invite Dr. Jamal Chaudhary to give an update? Dr. Jamal, you're on mute.
Yes. Thank you, Saurabh. Dr. Chong and the chairman and the distinguished our personalities. In Bangladesh, the cases are very low now, less than 200 per day. It's continuing for the last 1 month or more. And the number of deaths has reduced. Just day before yesterday, it was 1 only. So it's good. But the thing is that the SOP, which is needed for controlling the COVID-19, this is not observed everywhere, and people are relaxing actually, and everything is open, including the flights and international flights also. And I came to know that if the traveler is fully vaccinated, then he's not needed to go for quarantine. So it's open. And near about 19%, 19% is we are fully vaccinated here. And the children actually just from 12 to 17 are vaccinated now. and with Pfizer only. That is because the USA, I think they have endorsed for this range of children. So we have also started here to open, and the schools are open, of course, in a limited way. After the vaccination, it will be full. So actually, this is the scenario in Bangladesh, and we have started actually here. I don't know. There is some sort of this confusion is going on. Our actually drug controller has already approved the tablet molnupiravir produced by Merck, which I mentioned before, that they have submitted for emergency authorization from FDA. Still, it's not. They haven't got any sort of positive answer from them. But it's still here in the because the UK has started and UK has approved. So our drug controller also has approved, but before that they have submitted for clinical trial in via Medical Research Council. But I don't know, there is confusion. Before the trial ended, the drug controller has approved for marketing those molnupiravir. This tablet molnupiravir, you know, this is used in the mild to moderate cases, and it has to be used within 5 days of the symptoms arising. So that is, and they are claiming that it reduces 50% the death and the seriousness of the disease. So this is the scenario in Bangladesh. Thank you.
Thank you. And is the vaccination for children started yet?
Yeah, I told you. Children means if you say it's adolescent, but from 12 to 17 years.
Okay, 12 to 17.
Yes.
Dr. Ravi from Malaysia.
Hi, everybody. Okay, good news. I've got my booster shot, which I got only 2 days ago. Well, Malaysia is doing quite well. They have opened up every business. Life is almost like back to normal, except that wearing a face mask and maintaining social distance has become mandatory by law. If you are caught without a mask, you can be fined ringgit Malaysia 1,500. So people are not frightened of the COVID, they're frightened of the law. And so they're all wearing a mask and moving around everywhere. Cases have come, more than 10,000. It's come down, was about 5,000 last few days. Last 2 days, it has gone up to 6,000 plus. Vaccination, adult population, 90% have got 2 doses. Now the 12 to 17 years old are being vaccinated. About 40% have already been vaccinated. Yesterday, the Minister of Health announced that for the booster shot, about 46% did not turn up for the booster shot. All this is being given free by the government. The booster shot is also given free. Like in my case, it was Pfizer. So those who have had Sinovac will also get Pfizer as a booster shot. So the booster shot is only Pfizer. But people, I think, are very hesitant because of all the issues in social media and all that. But I only listened to one person, Dr. Chong, when he said he took his booster and he was able to go to France and come back in one piece. So I took the booster based on his thing, you see. So in fact, I tell a lot of my friends that, I got a friend in Singapore, he has taken a booster and he's okay. Everybody is afraid that they take booster and they might die, you see. So this is the fear, I think, which we need to get rid of from the people. But otherwise, things are going on as normal. Hospitalization deaths are around the 50 to 60 per day. But the policy here now is like this. If let's say you are found to be COVID positive, you will be home quarantined. If you are in stage 1 and 2, you'll be home, category 1 and 2, you'll be home quarantined. Then they will do a RTK PCR. And at the end, they will do an RTK PCR provided you have any signs and symptoms. If you're positive and you're still in category 1 and 2, it'll still be home quarantine for 10 days. But if you're in category 3 and 4, then you are transferred to a hospital. So that is the policy now that the government has taken. Thank you.
Dr. Ravi, Malaysia used AstraZeneca also.
Sorry?
Malaysia used AstraZeneca also?
Yes, AstraZeneca was given, but only a small population of them took AstraZeneca. And they so far need not take a booster, apparently.
So what is there anybody is here actually can give any data regarding the AstraZeneca? This so that actually the Pfizer has just said that yes, it has come down. Okay, but what about the AstraZeneca? Is there any sort of any data regarding AstraZeneca? Whether it also goes down also like that, so that you have to go for booster?
I think you have to ask those from South Africa, isn't it? They took AstraZeneca, I believe, right?
South Africa, I don't know. But in Bangladesh, part of it we have taken actually AstraZeneca. But we don't have any data actually regarding like Pfizer. That Pfizer said that it has come down to 79%. From 95%. But AstraZeneca, it was 80 to 82%. But how far it has come down by this period? We don't have any data. So
no data.
Yeah.
Maybe Angelique can tell us a bit more. Angelique?
Yes, thank
Dr.
you.
Akhtar?
Thank you so much. We didn't take the AstraZeneca. Remember, the data came out. We did receive AstraZeneca, and then the data came out that it's not. It didn't seem to be very effective against the beta variant. And we then subsequently sent it to the rest of Africa countries that wanted it. And for now, it is third on our vaccine portfolio. The first two is Johnson & Johnson and Pfizer. And if we then need, there will be, then AstraZeneca can be used. But we didn't use it. For now, no one has been vaccinated with AstraZeneca in South Africa under any open program.
I think India has used actually a lot of this COVID-19, which is biosimilar to AstraZeneca. So, what is there any sort of data from India whether it has waned or not? Dr. Pillai, you are muted. Can you just tell us? Because
no, we are using AstraZeneca, our own COVID-19, and the third, the booster dose. Not that it is not necessary, but our health, public health policy is that wait for the booster dose. And AstraZeneca, double dose we are giving. Side effects are almost negligible compared to the number of people who got the vaccine, almost 1.1 or more crore people have got the vaccine. So no major side effects have been found.
What about the waning of this immunity actually?
Pardon?
Is there any measure? Waning of immunity or protection?
Waning of immunity definitely is there, but we are not reached the stage to think about a booster dose. It's not that it is not necessary, but it's a public health policy that we wait till at least 85% of eligible population are vaccinated. Then, and because of that, the reinfection, even after getting an infection or after double dose, the number of reinfection or breakthrough infection rate is much less. Although the vaccine producers themselves say that protection is 87% for both the vaccines, but the number of reinfection definitely is less, particularly those who had an infection and double dose. Almost it is not there. But those who had just double dose, some do get infection, but hospitalization need definitely is not there, and the severity definitely is less. Even with the new variants, it is the spread of the infection which is a matter of concern, but severity of the infection is definitely less with the variants, because even the mutations, as far as the organism is concerned, virus is concerned, is their survival. So whatever mutation come, the objective will be to increase the spread and not destroy the host. So the severity definitely with the newer variants, although we had great concern about the severity of new variants, the severity is less definitely.
I think also, Dr. Pillai, if you can add, like, I also know that, you know, the government is also emphasizing on the minimum of 6 months gap period between the booster dose and the second dose of vaccination.
Yeah.
I know quite a few people who have actually traveled on an international trip and who were having a COVID shield, have taken a booster dose, which is a non-COVID shield, and there is no side effects also, which has been reported.
Yeah.
Especially the Pfizer was being taken as a booster shot. And both the doses were AstraZeneca.
Yeah.
So because in India it is not available till now, people who have traveled and have got an opportunity to take a booster shot, they have not gone back and said no, we will not take it. We have actually gone back and taken it, and there is no side effects which have been reported. In fact, they're doing well.
Yeah, that is true. There is no concern about side effect with the booster dose, but it is only our public health policy that let us immunize 85% of eligible people and then think of booster dose. But as you rightly said, those NRIs or those who do foreign travel, make it a point to have the booster dose wherever they are and come back.
In fact, one of the states in India, which is Mumbai, has claimed that they have almost vaccinated 99% of the eligible population. And India is all focused on giving the first or the second dose of vaccination as 100% right now.
Yeah.
Thank you.
Bombay, the metros definitely are aiming at full vaccination, at least 85%. And Bombay Metro is one which is almost attaining it. Today's paper, let's say that they are almost attaining 10% vaccination of eligible people there.
Thank you. Can we have South Africa, Dr. Angelica, and after that we can have Pakistan.
Thank you so much. As always, this is always interesting to listen. In South Africa, what happened in this past few days is that indication shows that the election that we had 2 weeks ago did not affect any infections. There was no provinces that have shown any spikes. Again, we are expecting our fourth wave December, January, because of movement of people. A lot of our people will go and visit Europe, and I'm quite sure they will bring back the variants from there. We are, in the meantime, trying to prepare for the fourth wave. We're focused on supply of oxygen, bed capacity, equipment, ventilators, and consumables. And then we've got a huge problem in South Africa with retention of staff. And there's no funding, you know. I'm sure this is the same in any other country. There's not enough funds for healthcare. There's a concern over low numbers of vaccination in young adults. Again, the same, driven by fake news. I actually read an article where some health person in Germany said that we are fighting two viruses. The one is SARS-CoV-2, and the other one is the fake news virus. And you know, I like that because it is like a virus. You are fighting fake news, but it keeps on spreading. Then we know that we have started our children. Dr. Adkat will give the numbers, but it's around about above the age of 12, 200,000 that has been vaccinated up till now. Unfortunately, one of our political parties, the Christian Democratic Party, took the National Department of Health to court regarding our policy to vaccinate children above the age of 12. And thank heavens, the court dismissed the matter as not urgent, so that will carry on. Then we have weekend drives. It's now the second weekend drive in the beginning of each month. We call it the Vuma weekend. And we encourage all citizens to come forward and reminded the public of the holiday season, that if we don't get people vaccinated, we might end up again, beaches will have to be closed, restrictions on movement. We don't want that. And yeah, the second dose of the Johnson & Johnson started for healthcare workers, started to roll out this week. It will continue till the 15th of December. We got donations from Johnson & Johnson, and around about 500,000 healthcare workers are eligible to go and vaccinate under the Sesonke. We call it Sesonke. This will now be Sesonke 2. Sesonke 1 was the first drive that we had in the beginning of the year. We also received Sinovac donations for our military, about 300,000 dosages, so they will use that. We haven't been using Sinovac for the public, so that is donated by France, and we'll see how that carries on. And that's it. I will leave the rest to Dr. Hussain.
Thank you, Angelique. South Africa is doing just like other countries. COVID is going down. People are very happy. Almost they are in a Christmas celebration mood. Shopping centers are getting busy. Last 24 hours, 393 new cases. Death rate came down from last 2 weeks. Now, yesterday it was only 17 deaths. Our recovery rate is 96.4%. And so far we have tested total 19 million. Out of that, 2.9 million was positive. Our total death till today is 89,469. We have still got active cases. From last 2 weeks, it came down to 16,000. Vaccine total was done 24 million. As you mentioned, children's vaccine started last few weeks. It came in a right time because in South Africa, matric exam is starting. So above 12 to 18, those children are writing matric, get the vaccine so they don't get sick, so they don't miss exams. So that's a very crucial. And the borders are open, international travelings are in and out now. There are still vaccine hesitancy there, but all the stakeholders trying their best to come up on that anti-vaccine groups. We don't have a choice for booster. We need to go. If you take in Johnson & Johnson, we have to take Johnson & Johnson. But there are demand that we can have a choice of Pfizer or Moderna, but we're still working on it. Thank you, Chair.
Thank you, Dr. Akhtar. Who else do we have Dr. D'Souza or Dr. Qazi?
Yeah, Dr. Qazi from Pakistan, and then we can have Dr. D'Souza from Australia. Dr. Qazi, right?
Okay, thank you, Surya, and welcome, Chong. I hope you had a good, enjoyable trip to France. And I was thinking that probably Kasser Sajjad would be here to present the country report. But anyway, I can say that the Pakistan is getting back to normal. People have, opened up. Everything is right. The life is as usual. Markets are open, transport is open, schools are open, and we are at the moment less worried of COVID, since we are facing the dengue fever, which is very endemic in Pakistan at the moment, and we are much worried about that. And lots of our COVID ward has been transformed into dengue fever management. The vaccination, we have completed almost 25% of the population. That is 47 million got the double doses, and the 77 million got the first dose, we are on with the booster dose. We used Chinese vaccine, Sinovac or Sinopharm, and the booster being offered is Pfizer, and it's all provided free by our health authorities. So we are on with that. And regarding the children vaccination, we have started a program where from 12 to 18 years, the children are being vaccinated, and the vaccine used is Pfizer. But the parents and the the community is very reluctant in going for the children vaccination. And since the number of cases have come down to our death in the last 24 hours was in single digit. It was 9. And the new cases are in a few hundreds. And the positivity rate is about 1.1%. So the things are much better. And, the traveling is on, and the international travelers who want to travel definitely need to have the Pfizer booster doses. And Pfizer is also available in Pakistan, and that is being offered free. That's the situation. And we hope that things remains under control, and we are, not heading for any other episode of new wave or anything. And thank you very much, Sarah. And thank you everybody for joining this group. It was wonderful listening to the various country reports, and fantastic. I mean, we keep ourselves updated about what's happening around the world and what's happening in the regions surrounding us. Thank you very much, Sarah.
Thank you, Dr. Kazi. That was a nice update. Can I have Dr. Russell?
Yeah, good day, Dr. Chung and Sharab. Sorry, I was a bit late. I was at a medical student conference. From Australia's perspective, we are going ahead. The focus is on vaccine. Victoria still has cases coming 1,000, between 1,000 a day or so. But of course, it's 80 or 90% are from the unvaccinated people. But it's things have opened out. New South Wales is probably only a few hundred. But vaccination-wise, Australia's progressed in that roughly around 69.70% of the whole country is double vaccinated. But if you take Victoria, it's 86%. We are hoping to reach 90. Probably on the 26th of this month or something like that. Sydney is already at 92 or 93%. So from that, these are the two main, that takes 60% of the population here. The others, there's still, say, New South Wales, Sydney has opened up. They've had some international flights. Victoria, hopefully at 90, they're going to open. They're proposing to open this state to international travelers. The hospitals, the good thing is probably with this number of patients, we not having, there are some deaths happening every day, but there is not too much of pressure on the hospital system, the beds and so forth. The intensive care is not overcrowded, or they're not under pressure as yet. The other important thing is that I think they've reached quite a good over 80% with regards to the 12 to 16 years, and the booster has started. So anyone who has had 6 months, so they had their injection, their vaccine at 6 months ago is eligible, and they have to. So people are started taking the booster, which is the Pfizer vaccine they're giving as the booster at the moment. Then, yeah, that's the main issue that I had that's here happening here. The other states, Western Australia, Sydney, Queensland, Tasmania, Northern Territory, are relatively no cases at all. So the cases are only in Victoria and New South Wales, which is going down. And of course, they opened up. They have as opposite to what was predicted, they actually had a drop in all the cases and so forth. That's a bit odd because all the epidemiologists warned and so forth. But some of New South Wales, Sydney has gone against that. It's the trend. What we're seeing is different from what was predicted. Right, and that's probably where we are in Australia, but certainly all are. Dr. Chong, you'll be able to come, I think, next month here.
I've already booked my flight.
I know. Every time I hear that, I think of you. Because Singapore Airlines is advertising they're having flights. Qantas has opened up, so all the plans are there, and we'll see all of you. Yeah.
I booked my flight on the 3rd of December.
Yes, I think Qantas has started from 6th. They're starting flights, I think, directly to Singapore.
Singapore Airlines has already booked our flight on the 3rd of December to see my son.
Yeah, I know that. We're all waiting to go out ourselves. We've been locked here for a long time, so hopefully we'll be out too. Great.
So Dr. Chong, are you supposed to, like when you went to France, are you getting COVID test before, after every arrival and departure?
Okay, what happens, just to share the experience, when we left Singapore, France did not require a PCR for us, just a vaccination certificate. And for the EU, I had to submit my vaccination certificate notarized. We have a website in Singapore that can notarize it. So we submitted it to the EU. But it took a long time for the EU to come back with in fact, I can show it to you. This is the digital certificate that I have for the EU. So this is a digital certificate by the EU, and there's a QR code.
Chang, is that certificate given by Singapore? That digital?
No, it's issued by the EU. It's issued by the EU. My certificate in Singapore is notarized. I just show it to you. We also have a QR code. QR code that we this is a certificate from Singapore. Sorry. Yeah, here with the QR code.
Yeah.
And this is my certificate. So we notarize it and then we send it to EU. EU will issue us this one, which is on my phone, and I go everywhere to a restaurant and so on. They'll scan this actually into an iPad or a phone, and then they'll let you into the restaurant. So in Europe, actually, it's quite good. Just restaurants, and of course, when you enter indoors, you have to wear a mask. You don't have to wear a mask outdoors, but most people walking on the street and all that, a lot of them still wear masks, especially inside the city center and so on.
So you applied from Singapore to get this EU certificate, is it?
Yes, that's right. I used my Singapore vaccination cert.
Yeah.
And then I applied for this. This one took a long time to come back. It took nearly 3 weeks to come back. So this, if you are going to EU, you have to apply for this. It takes a while to come back.
Well, we've got a conference, UNESCO meeting in Portugal.
But your certificate has to be notarized. That means
the Singapore certificate has to be notarized. We have a website in Singapore that can do it for us for free. This is the government website. They will notarize it for us for free.
So that means any country from here, we are going to Europe, you must have a notarized certificate. Okay, all right.
Yeah, with a QR code. So the QR for us, we have a QR code. So when we submit it to the EU, it's very easy. The EU gives us another QR code, but it took 3 weeks for it to come back. So I got it like a few days before I left. We applied for nearly a month before that. I think they're just very slow because they're overwhelmed by the big numbers.
Yeah.
And
they're having cases also there. So we also have a QR code, the Australian, the digital international one. So I think that must be all right. I don't know what the rules would be.
I've started jumping through the hoops for the Australia application. I have to download 3 apps so far from Australia.
Is it?
One for the visa, one for the travel declaration by the country, by the federal, one for the travel declaration by the state.
Good.
But Dr. Chong, can you just tell me what about this COP26? That there are 25,000 people attended in COP26. So what are the requirements actually? How they allowed these people from the COP26 held in the COP26
In Glasgow.
COP26. 25,000 people attended that conference. Okay, on climate change. Okay, so how they handle this? You have any idea?
I have no idea.
So this was really after COVID-19. It was a huge gathering, and I think it was relaxed. Actually, probably they didn't have to go. Actually, my son attended in a recent event in the UK. He had to get the Pfizer vaccine even, so he was lucky enough to attend that event, not COP26 but other event. So anyhow, a lot of people are going to UK, and what about the UK? Whether they are also allowing the people with all the vaccines, I don't think so. They are not recognizing all the vaccines. So we have to go for another attempt, so that from WMA it is again stressed, or again I guess they give importance, or they raise the question to the international community or the countries, so that they allow they recognize those vaccines actually listed by the WHO for traveling purposes. I think they should give a second attempt, so that the other countries also follow the same, like as US.
I haven't heard of anyone from Singapore using the Chinese vaccines to try to get an EU certification. I have not heard of anyone, so I don't know. I can't tell you, but yeah, certainly this is an issue. And remember, I brought it up with Dr. Kloiber. I'll follow up with him and ask him what's happening. All right.
Yeah.
Anyway, over in France and Spain, honestly, life was normal. You know, everybody was just moving around. And but everybody I noticed took precautions, you know. And when you entered indoors, for example, I went into a pharmacy to buy some antihistamines. I forgot my mask. They asked me to put it on and so on. Our restaurants were all very diligent in getting that QR code, asking us for the QR code on our phones. But otherwise, life was normal in France.
Europe is suffering again. Europe has become the actually seat of the infections again.
Yeah, that's right. But yeah, I think it's very important before you leave for Europe or wherever you're going to get a CPAS test, a neutralizing antibody test. Make sure and to get a booster, right? Make sure you're tip-top before you go. And for myself, when I come back to Singapore, I needed a PCR to 48 hours before I left Paris. And before I did the PCR, what I did was I did an ART test myself. I brought ART kits. So I did an ART test, and if it was positive, I will postpone my trip coming back. You see, so that's what I did. So these are some of the little things that that one can do. When I reached Singapore airport, it's all quite organized. They made us do the PCR on deplaning, on the disembarkation, and I went to stay in a hotel because I have my mother-in-law is 80+ years old. Although she's vaccinated, I was just being cautious. So I stayed in a hotel. PCR result came 6 hours later, and then I went home. So it was quite honestly, everything was quite straightforward. But a lot of documentation along the way, at check-ins and all that. They'll ask you for a lot of documentation. So I virtually carried a file with me like this. This is actually my file for Europe. So I actually carried a file with me whenever I went to the airport. So these are some of my experiences.
I hope when you're in the flight, you just not mixing up the flight and start reading this as a project. And
yes, Deborah.
Yeah.
Yes, I have to go to Portugal next March, but I'm afraid yet. I'm afraid.
No, there's a lot of documentation to do before you. Before you go. So, like in Australia, I'm leaving on first week of December. I started doing some of the documentation yesterday. There's a lot of documentation.
Dr. Chong, I think I have gone through this website of CDC yesterday, in USA, because one of my friend actually just queried, and he went to US but nobody asked about from him anything about the vaccination or others. Nothing, no test of. So that is why he was surprised. Actually, I have gone through the website and I have seen a lot of waiver.
Oops, I think we lost Dr. Jamal.
It's freeze.
Yeah, you lost? Oh, you got it?
We couldn't hear you.
Oh, sorry. Now okay? Now okay?
Yeah, you was talking about
Now it's okay?
Yeah, now it's okay. You're talking
Is
about
it
the
okay
US?
now?
Yes.
Oh.
Otherwise, if anybody else has any questions or any comments, otherwise, I think we can call the meeting to an end. It's 1:15. We're a little bit ahead of schedule today. Anything else from anyone?
Anyone we have left out? Because we see some of the names which we don't recognize because it's iPhone or something.
No, actually, yes, no country left.
We didn't have Nepal today.
No,
Yeah.
I don't think they are not.
Okay.
Yeah, they are not. They are not.
So thank you everyone for this 84th wonderful session and
Thank
a little
you.
relaxing.
Thank you. Thank you so much.
Thank you so much. Thank you. Thank you. Okay.
Thank you.